Hi, my name is Dr. Asta, and in today's anatomy class I'll be talking about hamstring muscles. Hamstring muscle is the muscle of back of the thigh. It's present in the back of the thigh and it consists of altogether 4 different muscles. Let's get into the detail of it. So altogether we have 4 hamstring muscles: semitendinosus, semimembranosus, biceps femoris, long head and short head of biceps femoris. There's one more muscle which is adductor magnus, which is kind of present in the back of the thigh, but about that muscle I'll be discussing in the medial aspect of the thigh later in other video. Now let's get into the origin of the hamstring muscles. Out of 4 hamstring muscles, 3 hamstring muscles originate from hip bone, whereas the only short head of biceps femoris comes from the femur. By the name itself we can make out that since it's a short head of biceps, it comes from the lower bone, and the long head of biceps, since it's a longer muscle, it comes from the higher level of bone, that is your hip bone. Now where exactly in hip bone does it originate from? So in hip bone we have 3 different parts: ilium, ischium and pubic. So ilium is the superior part of the hip bone, pubis is the anteromedial part of the hip bone, and ischium is posterior part of the hip bone. So since hamstring muscle is the muscle of the back of the thigh, it comes from its origin also happens from the posterior part of the hip bone. So this is the superolateral part from where semimembranosus muscle gets originated, and from the inferomedial part semitendinosus and long head of biceps femoris gets originated. Let me repeat again. Hamstring is the muscle of the posterior part of the thigh or the back of the thigh. So it's kind of you can use this logic in order to remember the origin of muscle, that the muscle which is present in the back of the thigh or the posterior aspect of the thigh originate from the posterior part of the hip bone, and the posterior part of the hip bone we have ischium. So the muscle gets originated from ischium. So this is the origin of altogether 3 muscles: semimembranosus from the superior part of the ischium, semitendinosus and long head of biceps femoris from the inferior part of the ischium. Now coming to the other origin, now we have short head of biceps femoris, that is left. That muscle gets originated from the lower bone, that is the femur. So in femur, so if we see the posterior view of the femur, we get to see linea aspera, which is there in the shaft of the femur. Short head of biceps femoris originates from the lateral aspect of the linea aspera, which is present in the posterior surface of femur. Now coming to the insertion of the hamstring muscles. So hamstring muscles, as we have already finished, the origin happens in the hip bone and in the femur as well. So now the 3 of the muscles like semitendinosus, semimembranosus and long head of biceps femoris, they cross 2 joints, one in the hip joint and the other one is the knee joint, whereas the short head of biceps femoris, it crosses only one joint, that is knee joint, and then the muscle gets inserted in the tibia and fibula. So all of these muscles are getting inserted in tibia and fibula. Now let's see where exactly it gets inserted in it. Now this is the tibia, and I have made posterior aspect of tibia here, where this is the medial condyle and this one is the lateral. So this is the medial condyle and this is the lateral condyle of the tibia. Semimembranosus muscle is inserted in the posterior surface of medial condyle of the tibia. Semitendinosus muscle is inserted in the medial aspect of the shaft of the tibia. Okay, gets inserted along with 2 other very important muscles. They are sartorius and gracilis. Along with semitendinosus we have sartorius and gracilis. So we have altogether S, G, S muscles inserting together in the medial surface of the tibia. So the other muscle left now is the long and short head of biceps femoris, and long and short head of biceps femoris together come and get inserted in fibula. So let's see, in the fibula, this is the head of the fibula and it gets inserted in the head of the fibula. So this is the insertion of long and short head of biceps femoris. Hamstring muscle is supplied by sciatic nerve, which runs in the posterior part of the thigh. Let me demonstrate how the muscle acts in the lower limb. Okay, so now talking about the course and action of the muscle. As we know, the three of the muscles are originating from the ischial tuberosity of hip bone. Where exactly is the ischial tuberosity? It's over here in the back of our gluteal area. When we sit down on a chair and just move in the sitting position, we can feel two pointed bones on both the sides. We are actually sitting on ischial tuberosity. So now let's see, it's originating from here and it's going down. It's crossing the hip joint and going down. It goes down and then along with the short head of biceps, it goes further down, crosses the knee joint and again gets inserted in the upper end of the fibula and tibia. Now in hip, the three muscles are again present posteriorly. So when it contracts over here in the hip joint, it causes extension of the hip. That way we have altogether two functions. One is to cause extension of hip and another is to cause flexion of knee joint. But short head of biceps originates from femur and inserts in fibula. That's why it can only cause flexion of knee joint. With this, I would like to end the video. Don't forget to like the video and subscribe my channel. You can also press the bell icon in order to get notified regarding the future videos. Thank you and bye-bye.